A lot of what you do and what we do is have little goals that we can achieve throughout that process. You will, ideally, we develop some trust, and then you start to follow the process a little bit more.
So the first place that I worked was a lot of chronic pain, a lot of chronic pelvic pain. So I got really well versed in that. At the end of the day, pelvic floor physical therapists are orthopedic physical therapists.
We take the good, and I wish things could be better. It can only truly happen if you take the reins yourself and then try to create this vision.
How are we supposed to talk about the pelvis when you're not even allowed to say the words associated with it? People are going and Googling in the dark, and then we get a lot of web submissions in the middle of the night.
Yeah. When you're alone with your thoughts, this spiral starts to happen where it's just essentially kind of dooming yourself.
If your nervous system is always ramped up, it's gonna ramp up your symptoms as well.
You don't have to be stuck in your thoughts all the time. Welcome to the HealthFit Huddle, where we keep you mobile and active, away from painkillers and surgery, so you can get back to the activities that you love. Today, I am excited to introduce to you Dr. Rachel Daof. She is the founder of the Pelvic Model, which is in Pasadena. Her passion for pelvic health began in high school, where she took courses in sexual psychology and women's health. As a dedicated pelvic health physical therapist, she has helped both men and women heal from a variety of pelvic floor dysfunctions. I'm happy to have you, Rachel. Welcome to the huddle.
Thank you.
All right, let's get started. Let's get a little bit of background on you and tell me a little bit about your background, your family, and where you grew up.
Yeah. So I'm first generation American. My parents are from the Philippines, and I grew up in Palmdale, California, which is, I'm a desert rat. Yeah, so that's pretty much my background, and how that relates to pelvic health is a little interesting, mainly because a lot of Filipinos are very Catholic. So I remember buying a book in high school or something, and it's called Cunt, and I got in really deep trouble for it. So yeah, I didn't even get to read the book. But anyways, I didn't get to read it. But because of that, I just feel like since then, I understood how much the pelvis was a taboo topic. And I think even from my earlier years, I didn't even know that this was a job. But I always felt that there was a need to destigmatize it, because there's a lot of things, how are we supposed to talk about the pelvis when you're not even allowed to say the words associated with it?
Right.
Yeah.
What even led you to pick up that book in the first place? I want to know the story.
Friend recommendation. She was a really avid reader, and she was my best friend at the time. And yeah, I don't know, she just recommended it to me.
Okay.
Yeah, and I bought it off of, I guess, eBay.
Right.
Yeah, and then got the book.
And then, how did your family found out? Is that why you didn't read it?
Yeah, because when you get things in eBay, I'm still a kid. So they're opening the box, seeing what it is. So they opened the box, read the title, and it was you're not reading this. Yeah.
So that I'm assuming, as any kid, you tell them not to do something, then you dive a little bit even deeper into it. So your family sees this. I can only imagine it, if I had a book like that, my family, they're like, what is this?
Yeah.
What was your explanation to them?
I forget what, I was just it's a book. I guess that was my natural reaction. I was a really good kid. I didn't really get into trouble, but those things are why is this a problem? I don't understand. It's a book.
Right.
Yeah. So I think I remember that feeling very well.
So you have this experience moving forward. You're still in high school at this point.
Yeah.
This whole idea of women's health and pelvic health and this taboo topic, how does it stay with you through high school? So you finish high school, and then you go to college where?
Oh, I went to San Francisco State.
Okay.
Yeah. This had, if we backtrack from there, during high school, it was like in my introduction too. So like I was also taking extra classes at the college, and I guess this is just like my natural interest, because the extra classes that I took was sexual psychology and women's history. So I remember that those were the first few college courses that I was taking. And then I feel like my bachelor's was in literature, but a lot of the time it's still, if I could have extracurriculars with like women's studies, I would always gear towards that. I feel like that's just my interests.
Okay.
Yeah.
So you're at San Francisco State, and you got your bachelor's. Did you know you wanted to do physical therapy?
No.
What's that story?
Yeah. So I was preparing to teach English as a second language in Japan. But they stationed me in a part of town that was completely wiped out from the tsunami. And I remember reading things, and it was like full of radiation at that time. I was like, oh, I don't want to go there. And then my aunt, who owns a home health care company, she was telling me, like, she was kind of a really good guide for me as a kid. I would always like go to her home health care, and then I would meet the physical therapist, and she was like, oh, maybe you should try something like this out. So that, and also at the time, because I was trying to shift my life away from teaching English as a second language, I was also taking care of my grandpa, and he had Parkinson's. So I was like, I was taking him to his physical therapy, treatments and everything. So I was able to see it, and then having my aunt guide me, it kind of just fell into place.
Okay.
Yeah.
And then so you ended up going to physical therapy school. Where did you go?
Chapman.
Okay.
Yeah, Chapman and Irvine.
And then while at Chapman, did you know you wanted to go this women's health route that entire time?
That's where I found out. Like the first trimester, I remember one of my teachers, my anatomy teacher in the cadaver lab, she was a women's health specialist, or pelvic health specialist in general. She treated all genders. And I remember her showing things around on the cadaver and relating the musculoskeletal system, nervous system to pelvic health conditions. And given like my natural instincts, I just gravitated towards that.
So so you have this gravitation towards it, you have this instructor, teacher. How did you like dive even more into it?
I did every project on the pelvis. Yeah.
Right.
Yeah. So any chance I got, like I was doing a lot of my, like, you can pick a topic for a lot of these assignments, and a lot of the time I would do, because I was still unsure, I was doing either like peds or women's health or the pelvis, and like towards the end, it was all pelvic health.
Got it.
Yeah.
So you graduate from Chapman. How many years between graduating from Chapman and then starting the pelvic model?
Oh, that's interesting. I believe it was 2 years.
Okay.
2 years, yes.
So with the 2 years in between starting the pelvic model, where were you working? What were you doing?
Yeah, I was working on the west side at one of the like boutique-y pelvic floor centers, and I also worked in the OC for a little bit as well. And one of my rotations was also in what is that hospital? Hoag. Okay. So I was able to see a lot of. So the first place that I worked was a lot of chronic pain, a lot of chronic pelvic pain. So I got really well versed in that. And then the second place that I worked in Orange County, they are a very pelvic pain heavy clinic as well, but I feel like my caseload started to be a little bit more diversified with like pregnancy and postpartum and other cases that I wasn't always seeing at my first clinic. And then Hoag, so the first two places, I didn't necessarily see any Medicare, Medicaid, but in the hospital, I definitely did. So I got a good chance to see like a wide variety of pelvises. Right. Yeah.
So what drove you to start your own business? Like, yeah, what drove you towards that?
I feel like now that I'm looking back at why I don't know, I just feel like One, I feel like I really wanted to make a place that's for the people. Mm-hmm. And I was like, I really think that this should be for the people and not just the patients. I also want it to be for the people, for employees too. So, like in the way that I practice too, I like to put the patient in the center. This is how I see it. The patient's in the center, and all their care providers are kind of surrounding it, and we're just kind of grabbing whoever we need for the person. And I feel like in a way, if I can do that somehow, like with employees as well, because I just want to make people happy and give people good lives. Yeah, that's where it came from.
Yeah, I think we've had HealthFit for almost 9-10 years now, and even before that, me and Kelly and I had our own like independent practices, and I think at the time it's similar. It's you understand that you want things to be a little bit different than what because that's why I was asked, like, where did you work before? Obviously, we learn from those experiences, but what we learn is like we take the good, and we also look at, I'm not going to call it bad, we're going to look at it in a way of, I wish things could be better. Yeah. And it can only truly happen if you take the reins yourself and then try to create this vision. Yeah. And I think early on it is hard because you haven't really stepped in yet. Yes.
And I feel like that's why it was really hard for me to remember where it started. But like now that I've been doing it for a while, that is why I want to keep going. Like It's like my main motivator. Yeah.
So what helps the pelvic model stand apart from other places that may be offering similar services?
Yeah. That's a really good question. So we have a new physical therapist at our clinic. She's been practicing elsewhere, and we've been upping our Instagram game. So,
well done.
And one of the questions that we were asking her, the person that was like interviewing her was asking her, was like, "Oh, what makes the pelvic model different from previous places that we worked?" And then her answer was, "This place really cares about the people." It just goes back to, I feel like that's just like the core of, everybody feels the essence of that when they're there. Everything is geared around helping people. Our staff meetings are geared around how do we help the people the best. We're always trying to have open discussions, taking the ego out of like the treatment and just really trying to help people. People. Yeah.
And I know certain people on your team, right? So you definitely have an amazing group. I think that, just like you said, and you've done a workshop at our facility. So I know you're very technically very smart and you know your stuff. But I think you and your team bring that human element to it all. And I think that's extremely important, especially even for us, like physical therapy, back pain, etc. But especially with pelvic health and the way, and it's such a sensitive subject. Could you explain to people what is pelvic health physical therapy, and then what kind of conditions are you seeing and treating?
Yeah. So pelvic health, the easiest way to put it is we help people poo, pee, and have sex, or experience any sort of like intimate pleasure. That, and we help people with pelvic pain, and that could be very orthopedic, like it can tie into low back pain, hip pain, groin pain, pain in the genitals and lower abdomen and everything like that as well.
How do people... What would you say to someone that's, let's say they're experiencing something like this, and it's a sensitive thing? How do most of your clients end up like finding you, or like, ooh, maybe I need to go to the pelvic model in order to address this?
Right. And this is something that I would hope, I know we're going towards a better direction in how people find pelvic floor physical therapists, But right now, I feel like it's still taboo enough where people are Googling. And I feel like they're having a bad day. They can't tell their friends or family. They go on Google, type in, I don't know, testicular pain, penis pain, what do I do? And somewhere along their Google search, we pop up. Yeah, so we get a lot of it through Google. And also, we've been doing a lot of work in the community as well, which is a big near and dear thing to what I want to do in Pasadena and Northeast LA. I want it to be a good place for people to know that their people are going to be taken care of with us. Yeah, so.
What kind of conditions do you see with men? You know, because it's not talked about as much. You're excited now.
Yeah, I love treating men. Yeah, so a lot of it could parallel with what females experience. So easy ones are like constipation. Men can be constipated. Tailbone pain. Men have tailbones. And things that people feel like is a female thing is like frequent urination, or if they go to the urologist is going to say they have like non-bacterial prostatitis. So prostatitis that's not due to a bacteria, and that typically is within our realm. It's like it kind of mimics interstitial cystitis, this painful bladder syndrome. So yeah.
So like, we'll dive into that a little bit more. What would you typically find with a male or a female that's presenting like that?
Interesting question. So with interstitial cystitis, we're actually the grade A evidence for that. So if you're feeling like you have a UTI that's not going away, you're taking antibiotics and you don't have an infection, and it's not going away, that's probably within our realm to assess and treat. So there's a lot of musculoskeletal things that go into this. So you have, it could be irritation around some of the pelvic nerves that can create some burning, stinging, stabbing along the penis. So if we're doing some sort of Tinel's test around the perineum, sometimes people will feel like a whipping sensation. And in females, in female anatomy, we also are able to screen for a hormonal component. So with that, if you have deficient hormones in the vestibule, because the vestibule is the opening of the vagina, and it also surrounds the urethra as well. So if you're having any hormonal deficiencies around the vestibule, that can be really irritating to the urethra, and it can create pelvic floor tightness and hypertonicity, and that can create it could feel like you need to pee all the time. And the vestibule is analogous, or the vestibule is embryologically from the same tissue as the bladder. So there's some crossover with that as well. So people who have irritated vestibules could have bladder symptoms.
Interesting.
Yeah.
Yeah, because I can kind of relate to how you're saying how people find you, because it's such a sensitive thing, and then you're like, ooh.
Yeah.
And then it's not something you bring up with your friends that often. It's like, hey, buddy, I have this.
Yeah, it's true. It's true. I feel like people are going and Googling in the dark, and then like we get a lot of web submissions in the middle of the night.
Right. Makes sense.
So we get it, and that's why we want to like just make it as easy as talking about like your elbow, so that you're like, we hear this all the time. You shouldn't be shy about telling us this. Yeah.
So if someone makes an appointment with you, what's the process look like? What does someone look to expect when they come and see you for an evaluation? What does that look like?
Yeah, so they would come in. We'd bring them we have private treatment rooms. So when we're doing the interview of like what brought to where you are today, like what kind of pain you're experiencing, everything is private. And the rooms are specifically set up to be trauma safe, meaning there's multiple lights in the room. So If you want it brighter, if that makes you feel more comfortable, or if you want it dimmer. And I think that's a big part of the pelvic model as well. We like to bring autonomy to the patient's treatment. If you want the lights on, you can have the lights on. We don't sit, if this is the table, the treatment table, and then this is the door, we're trying not to sit in between them and the door. So like just little things that we're trying to keep in unison with all of our treatments so everybody feels safe. So that's another thing too. I feel like we're pretty trauma informed. That, and back to the autonomy part, we even going forward with asking questions, we like to have consent first. Is it okay if I ask you about your sex life? Or if we're doing some treatment, it's like, is it okay if I touch your inner thigh? Is it okay if I go up towards the groin? And then letting them know things are going to happen before it happens. And also, too, with like the trauma-informed care as well, trying to tune into the patient and see signs if they're saying yes just because we're their provider is also important too. Somebody can be saying yes because we're trying to, we're the authority figure in the room when really they're just extremely uncomfortable. We try and give them autonomy through that as well. Raise your hand if that feels more comfortable to stop. Sometimes I'll ask, again, we don't have to do this. There's another way, we can. Just autonomy in the session to make them feel comfortable.
Yeah, I think that's key. It's you're involving them in the entire process the entire time. And it's, whether it's at the pelvic model or here, it's a partnership, right? You're trying to work together for the betterment of the client. So is there like a specific client or case that stands out in your mind of like this is why I do what I do?
I think, there's some people's cases really resonate with you. One of them I'm thinking of right now is that vestibulodynia case. Vestibulodynia, and then she'll have some of the interstitial cystitis symptoms as well. So it's those go hand in hand, and this happens through perimenopause and menopause. So these are some things that to look out for and to educate people on. But yeah, it's in theory things are gonna help, but when they start to unfold, it's really nice. Yeah. It's really good. Like, she's peeing normally, having sex with her husband, everything's normal, quality of life is great. Yeah.
Could you, depends on how much you're willing to share, about what was she when she first came in to see you? Obviously she has this diagnosis or whatever this pain is. What was it truly doing to her? How would you describe that?
I feel like with pelvic floor dysfunction, you see, just like low back pain, I'm sure you see this, people are typically, their nervous system is really ramped up, and there's a lot of muscle guarding, and particularly with the pelvic floor, the pudendal nerve is also autonomic. So if your nervous system is always ramped up, it's going to ramp up your symptoms as well. So yeah, if that's how I remember her presenting, like really guarded, very, 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 very anxious, wants to know exactly what we're going to do. But yeah, we got it. Yeah, we got it. It was good. It turned out to be great.
No, I think that early in the conversation, you were bringing up the team and making people feel comfortable. And I think that is like the first thing for anyone. Yeah. Because when they do present like that, whether it's pelvic health or chronic low back pain, like you said, they're sending inquiries in the middle of the night. It's because, yes, they're feeling it, but they're alone with their thoughts. And when you're alone with your thoughts, this spiral starts to happen where it's just like you're essentially kind of dooming yourself. So yes, I think a lot of what you do and what we do is, yes, we are physical therapists and
Yeah.
we go through an exam, but like you said, recognizing where they're at and approaching it in a way that's like step by step versus like, hey, we're not going to solve this in a day. It's let's illustrate the process, work with you, have little goals that we can achieve, and throughout that process, you will ideally we develop some trust, and then you start to follow the process a little bit more. So I really appreciate that part. Can you give me an example of a male patient that you've helped and done your thing?
Yes. Yes. Like I said, I do love treating men. So the ones that really stick out are the ones that are like in their 20s, mainly because they go to the urologist and they're like, I'm not supposed to be feeling these things yet.
Interesting.
Yeah, so the one that really comes into mind, when I met him, I think he was let's just say 24 years old. He was 24, and he was experiencing frequent urination. He's also in the music industry as well. So if he's doing a live performance, he just can't like get up and pee either. He has to like stay there, and he's a very, I love the guy, but very high-strung individual. So that would make him panic. So, and other symptoms, I know I talked about the frequent urination, but sometimes that urge can really be painful. For him, he was feeling like a whipping sensation throughout his perineum and all the way through his penis. And when I did meet him, he was very uncomfortable and had a lot of questions about what was going to happen. But yeah. Where do we go from here?
Well, seems like he's good.
Yeah. He's great. He's great.
Good now.
He's great. Yeah. So if we're looking for like what treatment looks like for that, we'll go through, of course, the consent that we talked about. He did consent to an examination. So what that typically looks like in the first visit is we want it to be very pelvic focused. At the end of the day, pelvic floor physical therapists are orthopedic physical therapists. So we do a lot of orthopedic techniques and follow like probably the next visit, but we really like to get a lot of the very pelvic health specific things out of the way. So a lot of that could be like visceral fascia assessment. So what does the fascia feel like around his bladder? What does it feel like around his belly, his abdomen, low back and glutes, and just around the sit bones as well. So we're assessing a lot of the myofascia and the visceral fascia, as that can create some urinary urge and frequency as well as pain. Typically, if there is time in the first visit, we explain how breath is very much connected to the pelvic floor. And so we're assessing their breathing. And if their breathing is controlled with their pelvic floor and if it's moving the correct way, and then that gives us an idea of where to go, as well as if you didn't know, so a pelvic floor muscle assessment is treated either intravaginally or intrarectally, where the therapist would use a single gloved finger, palpate the muscles through the vagina or through the rectum. And I guess that's where a lot of people become a little bit hesitant with pelvic floor physical therapy. With that, though, I feel like making them feel comfortable to be able to go through the exam and get treatment is pretty top priority for us as well. And once we garner trust with the patient, like we're pretty good at setting good boundaries and standards with that, so the patient feels comfortable and the therapist feels comfortable as well.
Right.
So, but yeah, so that's typically the the very quick version
Yeah.
of an evaluation.
No,
Yeah.
I appreciate you sharing, because that was one of the first words we said is taboo.
Mm-hmm.
And I think the more that we talk about it and then we use a language, it is normal language.
Yeah.
That hopefully the people seeking help for these conditions they do not seek it because of whatever, you know what I'm saying? It's just
it's
like,
scary.
yeah, it's scary. So I think, like you said, the more that we can normalize it and people get to realize that there is help,
Yeah.
that you don't have to be stuck in your thoughts all the time.
Yeah, that's true. And by the time you're talking to us, we talk about it all day, every day.
Mm-hmm.
So people preface things like, "Oh, I'm going to tell you about my bowel movements."
Mm-hmm.
It's like, yeah, tell me the size, the shape, if it's liquid, if it looks like Tootsie Rolls, like let me know, like you're in the right place. This is where you like tell me everything.
Okay.
Yeah.
That's cool.
Yeah.
Okay, we're going to step outside of the clinic. We're going to dive into your personal life.
Yeah.
You recently just got married.
Yes.
Congratulations.
Thank you.
How is married life?
I like it. It's
Yeah.
really nice. I feel like it's very smooth and steady, and life is good. Yeah.
And outside of, is he one of your biggest supporting factors in business and helping you through all this stuff?
He is a big cheerleader of mine. Yeah, he really supports what I do. Yeah, and he's also a business owner himself. So I guess whenever I get super busy or work off hours, it's really nice that he understands.
Right.
Yeah.
What do you like to do outside of work? Because I know you're a
Yeah.
geek. Yeah, and
Yeah.
you love pelvic health physical
Oh
therapy.
yeah, I know a little too much. Yeah, so outside of work, I honestly cook a lot. I like to try like really, it's actually delicious, but really clean recipes.
So you say, yes.
Yeah, yeah. So I cook a lot. Hanging out with cousins. We have mahjong night sometimes.
What is that?
It's a Chinese card game.
Oh, mahjong.
Oh yeah,
Yeah.
I say it differently. Yeah.
You don't say it the Chinese way.
Yeah,
yes.
no. Yeah, we play that. We eat sushi and play cards.
Yeah.
Yeah, hanging out with friends and family.
And then it is like, because you grew up in the desert,
Yeah.
is more family closer to here, or you have to go all the way out there?
Oh, we all moved to LA. Yeah.
Got it.
Yeah, we're all here
So
now.
everyone's close.
Yeah.
Switching back to the profession, you're a geek. How do you stay up to date with everything that's new regarding pelvic health?
That's a good question. When I started the business, I realized, and I still realize this now, I will never know everything. So trying to stay up to date with like continuing education. My favorite thing is going to conferences that aren't physical therapy led. I like to go to the medical doctor led conferences just so you can see like different perspectives on that. And I'm like, like I have access to like all like the menopause journal and like like the sexual medicine journal. Yeah, so I read that sometimes too. Yeah.
Just watching TV, reading a menopause journal.
Yeah.
There we go. What would you say? We had touched on it, but what would you say to someone that's feeling a little nervous? Like, let's say they're starting to Google. Mm-hmm. They're like, I don't know if this is for me, or I don't think this is going to help me. Like, what would you say to someone that's having these thoughts?
Yeah, I feel like those thoughts are extremely valid. Like, it is a weird thing to experience, especially if you haven't heard about it and nobody that you know like has been going through it. So you're not alone in thinking that you're alone. But in the grand scheme of things, there's a lot of people in the same boat as them. And I think the field is doing a better job of getting that message out there. It's not this weird, obscure condition. And yeah, like, and that if you have any questions, there are people, like, if you are Googling, like, I'm happy to answer, like, your question. We're pretty good at answering your questions, like, where you should go if you're experiencing XYZ, what you should do first. Should you go to your urologist first and then come here? Yeah, and I feel like we just need to destigmatize this thing.
Right,
Yeah.
right.
Yeah.
I agree.
Yeah.
What is next for you? What is next for your business in the next year or two? What would you say?
Oh, yeah. So I feel like we're growing. We're going to hopefully move into a bigger clinic. We just want to treat as many people as we can. People are finding, not just us, but pelvic floor physical therapy quicker and quicker. So I would want to help as many of them as possible. And yeah, like, I feel like with that, I just wanted to curate a really nice space for where people feel safe to go to. People feel like they can, like, open up and ask us questions. Very communal based. If you're thinking about Pasadena or Northeast LA, I want you to think that the pelvic model has your back for pelvis problems, and we make it not weird.
Yeah.
We'll make you feel good, and yeah, we just got you.
Yeah. Pee, poop, Tootsie Rolls.
Yeah.
They got you. They got you. Here's like an off question. Do you think the prevalence of pelvic issues is more now? Because I bring it up because of, like, the whole autonomic nervous system, psychosocial part of this all. And it's because in a lot of ways I see it in regular orthopedic physical therapy. It's like you said, if someone's had chronic back pain or chronic knee pain, it just spirals them in this place where there's this huge connection between this and where.
Oh, yeah.
And we live in an age where it's very, very high stress, and then everything they need quick results. Do you think that has something to play with what you're seeing?
Definitely. I really do think that. I mean, like, I'm just one person, but when COVID hit, everybody's stress levels definitely did spike. And I remember in 2020, I remember, like, wow, everybody's pain levels who were good, it was like everybody's having a flare right now. Everybody's having a flare, and everybody's sitting more. So that's not that great for the pelvic floor either if you're just sitting all day. Accompanied with, we do see a lot of high-performing individuals, people with very stressful jobs, software engineers, lawyers. They both sit and think all day.
Yeah.
Yeah, so things like that, writers. We see a lot of people who have very high-performing jobs, required to sit a lot, so they tend to be a little bit more sedentary. The pelvic floor isn't moving. They're probably not breathing that well because they're holding their breath trying to get stuff done.
Yeah.
But yeah, that if you're not breathing, honestly, your nervous system is taking a hit. So, so like all of those factors combined, I think it really is connected to stress levels.
Yeah, I think that's important to, one, obviously you recognize it, but even to leave it out there that it is part of this puzzle. And because typically when people search on YouTube or online, they're looking like, okay, like for back pain, like, what's the best stretch? It's like, yes, we can give you a good stretch to do, but if we're not identifying and treating all these other parts,
right,
you're going to get an incomplete type of experience or result. So if someone's searching for you guys, how would they be able to find you?
Oh, we're available on, well, you can Google us, thepelvicmodel.com. And we are also on Instagram, TikTok, YouTube, all at The Pelvic Model. That's how you can find us.
Awesome. Yeah. Is there anything, before we go, is there anything else you want to share with our viewers, our watchers? What would you say?
get a squatty potty. Get a squatty potty. Yeah.
Nice.
Yeah,
We
that's
have 2.
nice. Nice.
It's not TMI because this is normalized, right? But I do have 2. So awesome. Thank you for being here. We will put all of your information in the show notes, and feel free to reach out to the pelvic model if you're having any pelvic floor issues.
Thank you.
So we'll see you next time.
Thank you. Thank you.
Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.